The world could look like this to Ilian, or like this. Ilian could be blind. The 2-year-old suffered from retinopathy of prematurity.
Respirar despacio, tomar agua, sediento, abrazar con ganas. Todas son las cosas más hermosas de vivir, no cuesta nada. Comer con hambre.
Pediatric ophthalmologist Dr. Lucía Asturias is examining premature infants at the Unidad Nacional de Oftalmología in Guatemala City this morning to determine if a case of retinopathy exists and if so, at what stage. The Unidad Nacional is a nationally active, partially state-run organization that provides people with highest quality eye care at affordable prices and training for professional staff. After roughly 10 years in her profession, Ana Asturias has specialized in treating retinopathy of prematurity, ROP for short, for a good reason.
Because it was really frustrating to have patients or having the family to come to the Unidad Nacional asking why their babies weren't responding like the normal way, like they were already 1 year old and they couldn't see the things around and they didn't act normally. And it was really frustrating to have to tell them the bad news that they were going to be blind.
In babies born at the correct time, at 40 weeks of gestation, the blood vessels in the retina at the back of the eye are fully formed. However, in babies born prematurely, the retinal blood vessels are not fully formed. These babies, particularly those born 8 or more weeks early, are at risk of ROP. To prevent baby blindness, Ana Asturias and the Unidad Nacional have developed a program they have been implementing with the support of the Christian Blindenmission since 2019. At the Unidad's outpatient department, Ana Asturias examines preterm babies who have already been taken home but still have to be monitored. From here, it's a short walk to the neighboring Roosevelt Hospital, where the program was started. At the neonatal unit, all preterm babies are screened who were born before the 36th week of pregnancy and/or weigh less than 2,000 grams. To perform the screening requires a special light source and a lens to see through the pupil, which has been dilated using drops.
That's one of the amazing things about the eye, that you can actually see everything. You can see the blood vessels, how they are growing.
In Latin America, around 24% of childhood blindness can be attributed to ROP. In Guatemala, the rate of premature births is fairly high, and eye screenings are not standard care procedure. An excessive dosage of oxygen to preterm babies and other existing illnesses are additional risk factors. If retinopathy is not detected early enough, this has far-reaching consequences.
It also affects not just the vision of the baby, but the rest of the situation of the patient, the neurological development, the social development of the patients, the emotional also. The whole family will have to work for the patient.
The twins Ilian and Dana were born during the 34th week of pregnancy, weighed less than 1,000 grams and had severe retinopathy. Like many people in Guatemala, the family lives in humble circumstances. The grandparents help the mother with the twins, the father and the older children work. The babies were successfully treated using injections. Ilian was left short-sighted, and today he will be getting his first pair of glasses. To make this service accessible, even in remote regions, the Unidad and Dr. Asturias have built up a network. Of the 43 government hospitals with neonatal departments, 15 are affiliated with the program. The National Hospital of Coban, roughly 6 hours away from Guatemala City by car, is one of 8 hospitals where screenings are performed by a pediatric ophthalmologist. Dr. Paula Tres was trained by Ana Asturias and infected with her enthusiasm for combating ROP. The colleagues exchange views about cases and support each other in the care and counseling of patients.
Ana Lucía Asturias para mí es una persona muy importante y siempre le voy a agradecer porque sin ella la verdad es que no estaría metida en oftalmología pediátrica y mucho menos evaluando prematuros.
Paula Tres also sees families for outpatient monitoring at her own medical practice in Coban. That the babies wail so much during the screenings has mainly to do with the glaring light. Before the examination they are given anesthetic eye drops, and in most cases they go on sleeping peacefully directly afterwards. In all of Guatemala there are only barely a dozen eye doctors who specialize in children. That's why telemedicine is a decisive mainstay within the project and is offered at 7 hospitals. Pablo Martinez is on duty in Antigua today. In a 2-month special training course, the male nurse and a female colleague learned how to use high-definition cameras to make images of premature infants that they sent to Dr. Asturias per email afterwards.
Yo siento que sí es bastante importante porque si uno toma una buena foto, la doctora no puede detectar la enfermedad, ¿verdad? No puede dar un buen diagnóstico.
The senior physician evaluates the images in Guatemala City on a computer and posts her diagnosis in the system. The next morning, an ambulance brings a young family to the Unidad Nacional. They were referred by the hospital in Quiché to the north and had to travel around 5 hours to get here. Rosalina has severe retinopathy. Ana Asturias explains the disease to the parents and what she's going to do with a laser. In the meantime, the team specializing in babies prepares the treatment. The laser is used to burn and scarify sections of the retina where no blood vessels exist. This demands a high level of concentration and extremely steady movements. Ana Asturias loves this kind of precise work. The operation went well, and the doctor explains to the parents that they have to go to their hospital for the first checkup in a week.
Es una persona muy empática con las mamás, ¿verdad? Pues ella también es mamá y cuando le habla a la mamá de un bebé, yo creo que ella totalmente se pone en el lugar de la mamá.
Not every case of retinopathy has to be treated, but each one must be detected, correctly categorized and monitored where required. In 2023, around 1,750 babies were examined within the scope of the project. ROP was diagnosed in 281. In the majority of them, the disease disappeared all by itself. 55 preterm infants received the necessary treatment.
It makes like a really big difference with just a little bit of work.
Hola, buenos días.
One crucial factor for the project's success is the financial takeover of costs for examinations and follow-up treatments. Otherwise, many families couldn't afford them. As with lesbia Leticia Caala-Oxom, who lives with 3 children and her husband on his family's farm on the outskirts of Coban. Her twins were born weighing less than 1,500 grams and had to receive artificial respiration. In one of the 2, severe retinopathy was established, followed by injection treatment. Today, both boys are fine and in good health.
Anteriormente estaba trabajando, tenía mis pocos ahorros, pero igual se está invirtiendo porque no es nada fácil tener 2 hijos también a la vez. Y pues yo me siento muy agradecida por el apoyo brindado, porque sí, el tratamiento es costoso. Sí.
The goal is to integrate more hospitals and expand the program nationwide, although currently there is a lack of financial resources. That's why communication with the Ministry of Health and educational training are key pillars. Healthcare staff are being schooled online nationwide. Ophthalmologists getting a residency at the Unidad Nacional are trained to perform screenings. For Elian and his family, the project changed their lives. With his new glasses, the boy can explore the world completely differently now.
We have to do something for our country. We have to do something for our kids. And we also are here for a reason. So hopefully this is my reason.
Cosas simples en la vida, las cosas de la vida.